We tailor the simulations to meet their needs, knowing where they are, what their level is within the simulation.
Students here at the College of Nursing at the University of Manitoba are using, yes, virtual reality kits as part of their curriculum, which gives an immersive learning experience as opposed to some other virtual learning tools. Virtual reality is not just being used to play games, but it's now being used in healthcare lifelike scenarios as nursing students at the U of M now enter the virtual reality world.
By doing it in virtual reality, they have experience, they have exposure, which really helps them with some of their decision making when they're out there in the clinical environment.
The college opened 2 VR learning rooms at the university earlier this year and is being used in conjunction with existing simulation programs that use mannequins and standardized patients.
We do more of the prioritization, some of the mental health types of scenarios, things that really use some of their socio-emotive types of skills, the planning, the clinical decision-making, things where it's really where you have to be able to watch the students make their decisions in virtual reality.
The College of Nursing program has expanded by 50%, adding 120 students, and this was possible due to the implementation of VR simulations in 2022.
We're really focusing on that one-on-one with the patient, critical thinking, and their problem solving, as opposed to things like skills or the skill acquisition.
Turner says the scenarios in the program are high-frequency simulations, things that the students will see when they go into clinical.
For example, it would be something like diabetes that's very common, or a heart attack, or just dehydration, urinary tract infection, common scenarios that our students, when they go into clinical, see.
Manitoba Nurses Union President Darlene Jackson says the use of VR headsets is a good place for nursing students to get the feel of what it's like to be in an emergency situation. She says there is a major nursing shortage across the province, and the nurses that are working are experiencing burnout. She says it's crucially important to start recruiting young nurses to help fill those much-needed positions.
We really do need to stress how important it is to have mentors out there for these new nurses when they come out, someone that they can go through an experience with and then debrief and talk about, and did I do the right thing? Should I have done something different? I think that is crucially important when these young students come out, is to have an experienced nurse who has time to spend time with them and really work with them to get used to these situations.
In Winnipeg, Alex Karpa, City News.